It's not. Now, yesterday we came up to the different general management methods. You have got contamination and management of respiratory failure. We came all the way up to correcting fluid and electrolyte balance, including metabolic acidosis, convulsions. Today we'll do about antidotes. Now, what is antidote? Antidotes. Antidotes are substances that will antagonize or overcome the effects of a poison. Okay. If you are able to give the right antidote at the right time in the right dose, it will help in reversing the effect of the poison and can be life saving in several conditions. Right. But the problem is that in most cases or most of the poisons, they do not have an antidote as such. Even if they do have an antidote, it might be harder to actually specifically detect which type of poisoning the patient might have. So it can be tricky to give an antidote. In any case, antidotes are divided into three main types. Okay, one second. So antidote are of three types. You have physical antidotes. Physical antidotes will be something like activated charcoal. Okay, it is absorbing the poison on its surface. It is physically stopping the vertical poison. या फिर you can have chemical antidotes. Chemical antidotes will be पोटेशियम परमैंगनेट, ठीक है, या फिर एसिटिक एसिड, ठीक है. इन केस लेट्स सपोज दीज केमिकल एंटीटोड्स जो है दे विल फॉर्म कॉम्प्लेक्सेस, दे विल इनएक्टिवेट द पॉइजन बाय अ केमिकल रिएक्शन. सो इफ यू गिव एसिटिक एसिड इन केस ऑफ अल्कली पॉइजनिंग, या फिर पोटेशियम परमैंगनेट. अगर जनरली पोटेशियम परमैंगनेट कब देते हैं, बार्बिचरेट पॉइजनिंग है या फिर फॉस्फोरस से पॉइजनिंग है, ठीक है, जब देते हैं आप. यू कैन ऑल्सो गिव कीलेटिंग एजेंट्स, ठीक है. कीलेटिंग एजेंट्स विल बी एबल टू करेक्ट हैवी मेटल पॉइजनिंग, स्पेशली लेड या आर्सेनिक, कॉपर, मर्क्यूरी, इससे पॉइजनिंग हुआ तो आप कीलेटिंग एजेंट दे सकते हैं. कीलेटिंग एजेंट क्या करता है, कॉम्प्लेक्स फॉर्म कर देता, ठीक है. It will basically bind with that particular poison and it will form a complex. That complex will be inabsorbable, it will be indigestible, it will come out as it is. So you are essentially stopping poisoning because of that. Then you have pharmacological antidotes. Pharmacological antidotes जो है, they will bind to the same receptor or they'll bind to the same site as the poison. So for example, let's suppose there is one particular cell like this and it has a receptor. We have our poison P and we have our antidote A. ये poison, we know this fella will come and attach to this receptor and it will cause a poisonous reaction. Antidote has a higher affinity towards this site, meaning it will attach to that receptor or to that site more readily than the poison. It will replace the poison in a way. So if the poison is not attaching to that particular receptor, it cannot show any function. ठीक है, especially in case of drugs. ठीक है, फॉर एग्जाम्पल इफ द पेशेंट इज हैविंग मॉर्फिन पॉइजनिंग, आप बहुत ज्यादा मॉर्फिन दे दिए तो इट विल गो एंड अटैच टू ओपियोइड रिसेप्टर्स. नाउ फॉर एग्जाम्पल मॉर्फिन पॉइजनिंग में आप नैलाक्सोन दिए, naloxone जो है, it will bind to that same opioid receptor and it will compete with morphine for that position of opioid receptor, meaning morphine will not be able to attach with as many morphine or opioid receptors for poisoning to occur. It will be able to stop the poisoning of morphine by replacing it or by not letting it perform its function properly. That is one. या फिर let's suppose diazepam poisoning है, then you can give flumazenil. फ्लूमाजेनिल जनरली डायजेपम पॉइजनिंग में देते, इट विल रिप्लेस दिस थिंग डायजेपम. या फिर अगर ऑर्गेनोफॉस्फोरस पॉइजनिंग है, ऑर्गेनोफॉस्फोरस पॉइजनिंग में आप अट्रोपिन दे सकते. ओके, नाउ विल डिस्कस मोर अबाउट स्पेसिफिक पॉइजनिंग केसेस. सो फर्स्ट ऑफ ऑल लेट्स टॉक अबाउट पैरासिटामोल पॉइजनिंग. सो स्पेसिफिक ड्रग पॉइजनिंग में there are several drugs. We have discussed some of them as we went on in our pharmacology. Some of them we didn't, so we'll be discussing them here. So the important ones I'll repeat again. Poisoning. Paracetamol is quite common, okay, and it is relatively safe. Antipyretic cases may, you'll find this a lot. Paracetamol being used. Okay. and it is generally well tolerated. The problem will come when you give an excessively high dose, especially in people whose liver is not working properly and in infants. क्योंकि paracetamol is metabolized by conjugation. ठीक है, liver में एक process होता है called conjugation, in which what happens is there is one particular reaction called glucuronidation. Glucuronidation. ठीक है, this is the sort of conjugation reaction. Glucuronidation में क्या कर रहे हैं आप? You have one specific chemical compound called glucuronide, and that glucuronide will attach with paracetamol. ठीक है, and it will end up forming one particular metabolite called N-acetyl benzoquinone amide, NABQI. ठीक है, N-acetyl benzoquinone imine. अब ये NABQI जो है नॉर्मल डोज दिया पैरासीटामोल का, फॉर एग्जांपल यू आर गिविंग 1000 mg of paracetamol to a patient. ठीक है, या you are giving let's suppose 2000 mg in one day. ठीक है, I'm talking about a day. तो 500 के 2 टैबलेट्स दे रहे हैं आप, या 500 के 4 टैबलेट्स दे रहे हैं आप, या 650 के 2-3 टैबलेट्स दे रहे हैं आप. In any case, you are hovering around this range, then it is fine. The amount of N-acetyl, the byproduct that is formed, that is not a big problem. Generally what happens is when you give a very high dose to a child, अब ये adult dose जो है, in adults you can give up to a limit of uh, 10 grams. ठीक है, आप जब 10 grams के ऊपर जाने लगते, 10 grams and 15 grams का range, generally normal therapeutic range is around 3 grams. You should not exceed 3 grams. If you start going into the range of 10 to 15 grams in one day, that is when severe toxicity occurs. ठीक है, this is in adults. चिल्ड्रन में डोज कम रहता. ठीक है, इन अ चाइल्ड जनरल डोज ऑफ पैरासीटामोल विल बी 10 to 15 mg पर केजी. ठीक है, इतना थोड़ा देते. अगर लेट्स सपोज 20 kg का चाइल्ड है, तो यू विल गिव समवेयर बिटवीन 200 to 300 mg. ठीक है, यू विल ब्रेक द टैबलेट एंड यू विल गिव इट टू द पेशेंट. ठीक है, अब maximum dose that you can give in a child will be no more than 4 grams in one day. ठीक है, that will translate to somewhere around 100 mg per kg per day. एक child में you should not give more than 100 mg per kg per day. That is the maximal limit. When you start going over that, see, children do not have completely developed livers, so they will not be able to metabolize, and they will not be able to throw out paracetamol's byproduct as quickly, because of which what happens is NABQI starts getting accumulated in their body, in their liver. It will start getting accumulated, and they'll initially start showing symptoms like nausea, vomiting, anorexia, abdominal pain in the first 24 hours itself. Okay, later on, if you're not able to correct it within time, it will lead to severe and irreparable hepatic damage. It will go towards the territory of hepatic necrosis. Okay, what this NABQI does is it will bind to hepatic proteins and it will cause necrosis. That is why it is dangerous. थोड़ा amount अगर form हो रहा है, your body is able to handle it. If you are giving it into a chronic alcoholic who has liver damage, or who if you are giving it to infants, उनके अंदर हेपेटोटॉक्सिसिटी होने का चांस बहुत ज़्यादा हाई है with paracetamol. Now paracetamol का specific antidote will be something called N-acetylcysteine. ठीक है, now this N-acetylcysteine you can give it as an IV infusion, 150 mg per kg IV infusion, 150 mg per kg IV infusion, या फिर आप ओरल भी दे सकते हैं. ओरल दे रहे बोले तो यू गिव अराउंड 140 mg per kg. ठीक है, लोडिंग डोज यू विल गिव इट एज 140 mg per kg, then you will follow it up by 70 mg per kg every 4 hours. You can give up to 17 doses till जनरली अप टू 17 डोसेस, उससे कम देते, बट अप टू 17 डोसेस में मैक्सिमम पैरासीटामोल पॉइजनिंग ट्रीट हो जाती. Okay. Another thing you can do for treatment of paracetamol poisoning is perform stomach wash. Okay. You will give stomach wash. You will perform. You will give the patient activated charcoal so that absorption of paracetamol occurs and paracetamol is not being absorbed anymore. Okay. Absorption will occur on the surface of the activated charcoal. Absorption will be stopped into the body. ठीक है, so paracetamol is not getting into systemic circulation anymore. N-acetylcysteine also partly replenishes your glutathione reserves, so it is helpful in metabolizing whatever amount of paracetamol is present inside your body as well. Okay. It also prevents in binding of toxic metabolites to cellular constituents. So the chance of hepatic necrosis occurring, that also decreases. Okay. NABQI is dangerous because this fellow will bind to hepatic proteins and it will cause necrosis. If you're able to give something like N-acetylcysteine, it will stop that binding temporarily. Okay. Then we have atropine poisoning. अब atropine जो है, atropine, scopolamine या hyoscine, all of them come from a plant called belladonna. ठीक है, belladonna या फिर दतूरा के जो plants रहते हैं, you also find it as hyosamus. उसके plants में they will contain hyoscine. Generally इसकी poisoning जब होती when children eat it, the datura fruit accidentally. दतूरा या belladonna अगर गलती से खा लिए, that is when there will be therapeutic overdose. Sometimes it can be therapeutic overdosage, or it can be excessive absorption of belladonna plaster, या फिर it can be children who are eating these fruits. ठीक है, these are the three main ways through which atropine poisoning will occur. Now patients who do have atropine poisoning, they will present symptoms where they have excessive cholinergic function. ठीक है, acetyl choline बहुत बढ़ जाता है उन लोगों के बॉडी में, because of which they will start having symptoms like dry skin, fever, dry mouth, dysphagia. They'll not be able to swallow properly, dilated pupils. They'll start having delirium, nervous symptoms आने लगते हैं, muttering delirium बोलते हैं उसको. They'll start muttering nonsense. Okay. They'll start having palpitations. They'll be restless. There'll be a lot of excitement and hallucinations. So atropine poisoning may, the patient will have dry skin, patient has fever, dry mouth, okay, dilated pupils. The patient might have dysphagia, restlessness, palpitation. Okay. General excitement will increase. Some patients will have hallucinations. Okay. They might even have severe hypertension. Okay. Some patients, they will have difficulty in passing urine or passing stools. Some people also have convulsions, and they might end up in coma. Okay. There is one specific antidote to this called physostigmine. Okay. आप physostigmine दे सकते हैं in case of atropine poisoning. Generally what you do is physostigmine 1 to 2 mg IV is given. All right. That is the specific antidote because it is an anticholinesterase drug. Now gastric lavage दे सकते हैं आप tannic acid से मिला के. Generally gastric lavage दे सकते हैं if you are giving it orally. If poisoning is oral, then you give a gastric lavage. You can give saline purgatives. ठीक है, saline purgatives will be helpful in preventing absorption of the drug. You can because the patient is having fever, आप sponging कर सकते. Tepid water में cloth को डुबा के you can sponge the patient's forehead. ठीक है, so that their fever comes down a little bit. You can give small sips of water because they are having dry mouth. थोड़ा moisten करने के लिए you can give small sips of water. All right. Now they are having a problem in passing urine, so you should not give a lot of water to them at one time. ठीक है, तो आप क्या करते हैं, थोड़ा थोड़ा sips of water देते हैं उसलिए. You can give sterile saline as well. It can be instilled into the eye to because their eye will become dry as well. In that case, you can prevent that dryness of the eye by inducing a little bit of saline. Okay. समटाइम्स आप फाइसोस्टिग्मिन के आई ड्रॉप्स भी दे सकते हैं. ठीक है, अगर माइड्रियासिस हो रहा पेशेंट को, सीवियर माइड्रियासिस, दैट इज पीपल डायलेशन, इन दैट केस आप फाइसोस्टिग्मिन 1% सोल्यूशन थोड़े ड्रॉप्स डाल सकते हैं. इन सर्टन केसेस यू माइट हैव टू कैथेटराइज द पेशेंट. कैथेटराइजेशन ऑफ ब्लैडर इज डन. ओके. So that is about atropine poisoning. Now we come to barbiturate poisoning. Barbiturates, इसकी पॉइजनिंग रेयर है आजकल, क्योंकि barbiturates as such are not being used as much. ठीक है, benzodiazepine यूज बहुत कॉमन हो गया, barbiturates को उतना ज़्यादा यूज नहीं कर रहे. बट इन एनी केस वी हैव वन कॉमन barbiturate कॉल्ड phenobarbital. उसकी पॉइजनिंग हो सकती, because this is the more commonly used one. Generally, if you give 6 to 10 grams of phenobarbital in one day, that will cause poisoning. That is toxic dose. That is technically fatal dose. The patient might die. ठीक है. Specifically, the patient will have respiratory depression. Other than respiratory depression, they might also have hypertension, skin eruptions, cardiovascular collapse. Their cardiovascular system will not work properly at all. So it is kind of a severe emergency where you need to act very, very quickly before the patient will die. ठीक है, because respiratory depression हो रहा and cardiovascular collapse हो रहा, तो if you're not able to treat them within minutes, the patient will die. ठीक है. There is no specific antidote for this phenobarbital. You can only give certain conditions, so you can induce certain conditions so that you are removing phenobarbital from the body. You can perform a gastric lavage. ठीक है, gastric lavage is basically stomach wash, a type of stomach wash. ठीक है. You will administer a little bit of activated charcoal as well to avoid absorption of barbiturates. Other than that, one important thing that you have to do, very important thing, is maintain the patient's airway, because उन लोगों के अंदर रेस्पिरेटरी फेलियर बहुत कॉमन है. पेशेंट्स हु हैव बार्बिचरेट पॉइजनिंग, उनके अंदर मेंटेनिंग एयरवे, proper airway, open airway is very, very important. You have to make sure that adequate ventilation is being given to the patient. Sometimes oxygen भी administer करना पड़ता patient को. ठीक है. You have to you have to maintain BP and fluid balance. ठीक है, because hypotension can occur in phenobarbital. You have to make sure that fluid balance is maintained and BP is maintained. One another way of kicking phenobarbital out other than gastric lavage is by giving diuresis or inducing alkaline diuresis. Forced alkaline diuresis बोलते हैं उसको. Now for this you can give furosemide. IV furosemide यूज कर सकते हैं, या फिर आप IV fluids दे सकते हैं, या फिर सोडियम बाइकार्बोनेट दे सकते हैं. All of them will make sure that the drug is being urinated out, it is being excreted out of the kidneys, especially in case of long acting barbiturates as well. ठीक है, उसके अंदर आप diuretics दिए तो बहुत अच्छा रहता. In some cases you might have to give hemodialysis as well. Okay, if the patient is not able to stabilize in time, hemodialysis करना पड़ता patient को. So that is about barbiturate poisoning. Then we have digitalis, कार्डियक ग्लाइकोसाइड. ये आप कब देते हैं? कंजेस्टिव हार्ट फेलियर या कंजेस्टिव कार्डियक फेलियर, व्हेन द कार्डियक कंट्रैक्टिलिटी इज नॉट प्रॉपर, दैट इज व्हेन डिजिटालिस इज इंडिकेटेड. अब डिजिटालिस की पॉइजनिंग बहुत कॉमन है, बिकॉज डिजिटालिस इज अ नैरो थेरेपेटिक इंडेक्स ड्रग. ठीक है, इट्स एनटीआई. उसका मतलब ये है एट अ वेरी स्मॉल चेंज इन डोसेज विल लीड टू पॉइजनिंग. ठीक है, एज सच इसका नॉर्मल डोज विल बी समवेयर बिटवीन 1 to 2 mg. ठीक है, अगर आप उससे थोड़ा बढ़ के दिए तो पॉइजनिंग हो जाता. सो इट इज वेरी कॉमन टू हैव डिजिटालिस पॉइजनिंग, डिजिटालिस और डिजिटॉक्सिन पॉइजनिंग, डिजॉक्सिन या डिजिटॉक्सिन, either way, because the safety margin is very, very low. Now you will see extra cardiac toxicity and cardiac toxicity in case of digitalis poisoning. So extra cardiac toxicity may you will start seeing symptoms like, so extra cardiac symptoms, the patient will start having anorexia, nausea, some patients will vomit. This is specifically because digitalis is able to stimulate your CTZ. Chemotrypsone को directly stimulate करता. That is why the patient is having nausea and vomiting, severe nausea and vomiting. They might also not eat anything because of nausea and vomiting. That is why anorexia, and they might have diarrhea. ठीक है, this is all due to CTZ stimulation. Some patients will have weakness, confusion, hallucinations, pretty common. ठीक है. Some patients might even have blurred vision because of digitalis. Now, cardiac toxicity specifically will be presented as arrhythmias. ठीक है. 1 second. Cardiac symptoms. These will be several types of arrhythmias. The patient can have bradycardia or bradyarrhythmia, or they might have AV block. ठीक है. Specifically because of ventricular tachycardia या fibrillations की वजह से the patient might have um, hypokalemia. Especially what happens is if the patient is hypokalemic, if they have lower amount of plasma potassium, वो condition में digitalis toxicity increases or it enhances. Potassium is responsible for normal rhythm of your heart. ठीक है. Normal conductivity of क्या बोलते, स्टिमुलेशन इन हार्ट इज वन फंक्शन ऑफ पोटेशियम. अगर पोटेशियम कम रहा तो जो कंडक्शन हो रहा आपके हार्ट में from your SA node to AV node to your Purkinje fibers and so on, that conduction will not occur properly. So if the patient already has hypokalemia, in that condition, digitalis poisoning will become very, very apparent. Okay, it will enhance the effect of digitalis in a way. So treatment of this thing, there is one specific antidote तो नहीं बोल सकते, but there is something called anti-digoxin immunotherapy. You give antibodies that are able to destroy digitalis. That will be the specific antidote in a way. It can be life-saving in severe poisoning cases. अब आप, what you will do for treatment is, first of all, you have to stop the dose of digitalis. ठीक है. Give oral or parenteral. Parenteral potassium. Now be careful when you are giving potassium or supplements of potassium. Make sure that you are infusing it very slowly, because I told you yesterday, if you give potassium very very quickly, that itself can cause cardiac problems. ठीक है. पोटेशियम लेवल सीरम में एकदम से नहीं बढ़ना चाहिए. यू गिव इट वेरी वेरी स्लोली. ओके. यू कैन ऑल्सो गिव, अगर वेंट्रिकुलर अरिथमियास हो रहा है, वेंट्रिकुलर अरिथमियास में यू कैन गिव फेनिटोइन. हेल्पफुल. आईवी फेनेटॉइल इज जनरली गिवन. अगर पेशेंट को ब्राडिकार्डिया हो रहा तो एट्रोपिन दे सकते हैं. ठीक है. अट्रोपिन या सुप्रावेंट्रिकुलर अरिथमिया हो रहा बोले तो बीटा ब्लॉकर भी दे सकते हैं आप. सुप्रावेंट्रिकुलर अरिथमिया में आप प्रोप्रानोलॉल दे सकते हैं. That's a standard beta blocker that is given. Specific will only be antibiotic fragments. जो immunotherapy है, anti-digoxin immunotherapy, you will get anti-digoxin immunotherapy. वो क्या रहता बोले तो उसमें digoxin के against antibodies रहते. Those antibodies are able to destroy digitalis. Okay, you might use that, but it is not necessary that you will find it very easily. So you might have to perform other things. Okay, so that is about digitalis poisoning. Now coming to methanol poisoning. Now methanol जो है, it is normally not used altogether. Okay, very very rarely it is used for any, it does not have any therapeutic value. The only toxicity that occurs is by accidental ingestion. Methanol जो है, it will act similar to ethanol in the sense that methanol also gets converted like ethanol. So methanol gets converted into formaldehyde, okay, using the enzyme alcohol dehydrogenase. Alcohol dehydrogenase, okay. Then this formaldehyde will be converted into formic acid. Okay. This conversion of formaldehyde to formic acid is done by aldehyde dehydrogenase. ठीक है. अब नॉर्मली अगर आप एथेनॉल को देखें तो एथेनॉल विल गेट कन्वर्टेड इनटू एसिटाल्डिहाइड, एसिटाल्डिहाइड विल बी कन्वर्टेड इनटू एसीटोन. अब यहाँ पर, सॉरी एसिटिक एसिड नॉट एसीटोन, आपके अल्कोहल से एल्डिहाइड फॉर्म होता है, एल्डिहाइड से एसिड फॉर्म होता है. दैट इज द नॉर्मल मेटाबॉलिज्म ऑफ अल्कोहल्स इन योर बॉडी. अब यहाँ पर मेथनॉल के जो टॉक्सिक इफेक्ट्स रहते हैं वो आते हैं फॉर्मेल्डिहाइड से एंड फॉर्मिक एसिड से. दोज टू आर द मेन पॉइजन्स, दोज टू आर द toxins to your body. What they will do is they will cause vomiting, they will cause headache, vertigo, they might cause severe abdominal pain, they'll cause hypotension, delirium, CNS effects start हो जाते. The patient might go into coma. ठीक है, देयर विल बी सिवियर एसिडोसिस. स्पेशली फॉर्मिक एसिड जो है, इट हैज अ स्पेसिफिक एफिनिटी टुवर्ड्स योर ऑप्टिक नर्व. ठीक है, formic acid tends to get accumulated in your optic nerve and it might cause retinal damage to the extent that sometimes it will cause blindness. It is told that as much as 15 ml of methanol is enough to cause blindness. ठीक है, and death generally occurs due to respiratory failure in this. So whenever you're treating for methanol poisoning, one short way you can treat methanol poisoning is by giving ethanol. ठीक है, आप एक अल्कोहल को ट्रीट करने के लिए दूसरा अल्कोहल दे रहे. वाई? एथेनॉल जो है इट विल compete with methanol for these enzymes. अब methanol, whenever methanol itself is not dangerous, it is getting converted in your body into formaldehyde and formic acid which are dangerous. ठीक है, अगर आप एथेनॉल दे सके पेशेंट को, it will compete with alcohol dehydrogenase. Ethanol has a higher affinity towards alcohol dehydrogenase than what do you call this thing, than methanol. Because of this, it will, so क्या होता है यहाँ पर मेथनॉल को अप्लाई होने के बजाय अल्कोहल डिहाइड्रोजिनेज विल स्टार्ट मेटाबोलाइजिंग एथेनॉल. टू पुट इट इन अनदर वे, मेथनॉल जो है इट इज यूजिंग अल्कोहल डिहाइड्रोजिनेज टू फॉर्म फॉर्मल्डिहाइड, राइट? अगर आप एथेनॉल दे दिए इन अ पेशेंट हु हैज मेथनॉल पॉइजनिंग, आप एथेनॉल दिए, what will happen is whatever alcohol dehydrogenase is being used by methanol, all of it will be robbed by ethanol, or most of it will be robbed away by ethanol. So what happens is ethanol gets converted using alcohol dehydrogenase into acetaldehyde. This is also not good for your body, but it is not as bad as formaldehyde. For acetaldehyde will finally get converted into acetic acid. तो आप क्या कर रहे हैं, फॉर्मेशन ऑफ फॉर्मल्डिहाइड एंड फॉर्मिक एसिड को ही रोक दे रहे. So that is one of the most important things that you can do. If you want a specific antidote, there is something called fomepizole. अगर ये अवेलेबल नहीं है तो आप इथाइल अल्कोहल यूज कर सकते हैं. अगर फोमेपिजोल यूज अवेलेबल है तो वो दे सकते हैं. फोमेपिजोल क्या करता है, इट विल इनहिबिट अल्कोहल डिहाइड्रोजिनेस. if alcohol dehydrogenase is inhibited, you will not have the formation of formaldehyde or formic acid. ठीक है, ethanol will compete with methanol for that same enzyme. Fomepizole will stop that enzyme altogether. Okay, there is a big difference in both of them. The antidote is stopping the enzyme that is converting methanol. Ethanol is competing with that same enzyme to form a different product. Instead of formation of formaldehyde, acetaldehyde is formed. ठीक है, acetaldehyde will cause problems to your liver, but it is not as bad as formaldehyde. Other than that, see, one thing you have to make sure is you have to protect the patient's eye. क्योंकि क्या होता, one thing you can do is make sure that you are performing the treatment when they are in dark. Keep the patient in a dark room. ठीक है, light sensitivity can damage their retina severely. तो आप क्या करते हैं, you'll keep them in a dark room and you will try to reverse acidosis, because in the presence of acidosis blindness will be very fast. Retinal damage occurs at a faster pace because of acidosis. तो आप acidosis को correct करना पड़ता. You can give फॉर्मिक एसिड की वजह से एसिडिक हो जाता बॉडी, specifically blood. So acidosis will accompany the effect of formic acid on eye as well. It will cause blindness. That acidosis plus for acidosis plus this thing आपका formic acid. तो आप क्या कर सकते हैं, you can give sodium bicarbonate. ठीक है, infusion of sodium bicarbonate if you are able to give in time, you will be able to prevent blindness in the patient. ठीक है, you can perform gastric lavage. बीपी एंड वेंटिलेशन मेंटेन करना पड़ता है आपको. ठीक है, डेथ इन पेशेंट्स विद मेथनॉल पॉइजनिंग जनरली अकर्स ड्यू टू रेस्पिरेटरी फेलियर. सो मेंटेनिंग योर वेंटिलेशन इज वेरी इंपॉर्टेंट. ठीक है, another thing you can do is give hemodialysis. ठीक है, hemodialysis if started as early as possible, you'll be able to eliminate as much methanol in the person's body soon. ठीक है, so that is about methanol. We'll discuss about acute alcohol intoxication and other types of poisoning along with snake bite tomorrow, day after tomorrow. Right.